This segment is sponsored by VCU Health.
The doctor is in and you have questions. According to the CDC, obesity is a common, serious chronic disease with many contributing factors. Neighborhood design, access to healthy, affordable foods and beverages, and access to safe, convenient places for physical activity certainly can all impact obesity. Dr. Ryan Fairley, weight loss surgeon with VCU Health, is with us talking about and bringing awareness to the prevalence of obesity and share more about how VCU Health offers hope to those who are struggling. It's great to see you, doctor.
Good morning.
Good morning to you. This is definitely one of those things that is certainly top of mind at any time for somebody struggling with obesity. As we look to make a new turn in the new year and look ahead, it's definitely a conversation that's top of the list. How common is obesity here in the United States, and how has the pandemic influenced the prevalence?
So the prevalence of obesity in the United States is reported to be around 42%. In 2020, 16 states reported obesity rates at or above 35%, and this was up from 12 states the year prior. Since the pandemic began, 42% of adults actually reported that they had gained weight according to a Harris poll. And those adults had gained on average about 29 pounds. So people with obesity are definitely at increased risk for developing a multitude of conditions, including heart attacks and strokes, which contribute to some of the leading causes of death in the United States.
The impact of having this condition and living with this is significant. And as you said, there have been some big changes in the last 2 years. We're out of pattern. We're out of the things that maybe that were working well for us. What are you seeing with patients on how best to manage and prevent obesity?
So there's no one single cure or simple solution for tackling obesity. And that's why it requires a multidisciplinary approach and tailoring those patients who want to lose weight. That's why I really enjoy the practice that I'm in and work at VCU with the group of our clinicians, dietitians, therapists to help work together with our patients on their weight loss journey. And we not only work with the community of Richmond, but we work with the state to bring local and national resources for patients and working on getting them to eat a healthier diet and improve their activity.
You've joined the team here at VCU Health in the last year or so and bringing that expertise here. How is this program different? What does it offer?
So at VCU, we partner with you in your journey, and this is from before surgery, during your operation, and then lifelong after your procedure. We were actually the first center in Virginia to perform the laparoscopic gastric bypass and have since done thousands of bariatric operations. And for me, I really enjoyed bariatric surgery because I get to see those patients post-operatively in my clinic, not only who have lost weight, but who have either come off completely their medications or at least decreased their dose on their need for medications contributing to their high blood pressure, diabetes, and coming off their CPAP machines for their sleep apnea.
Some significant changes that are possible. And as you mentioned earlier, 42% of the population is pretty incredible. What options are you offering patients who are looking to make a change in this year ahead in terms of their weight loss journey, Dr. Fairley?
Well, first off, I want to commend all those people out there that want to change their lifestyle and lose weight. It's important to remember that VCU not only offers a surgical approach to help weight loss, but also non-surgical approaches with our dietitians and therapists to help work with them. A good first step is knowing what your body mass index is. It's kind of a rough estimate to gauge your weight. And the number 30 is on average reported to be obese. So if you're at a BMI of 30 or greater, that's when you are considered obese. And 35 and up is when we start talking about surgery. So in reversing obesity, it requires a lot of lifelong changes, especially with habits that people have had for years and years. So that's why it takes essentially a village of people to work with them to help keep them on track and be with them through the hard times, as well as making sure to reinforce and encourage them on their benefits and their successes during their weight loss or their weight loss procedures.
Absolutely. Working with a team of professionals that can help pave that road and take that journey with you. It was wonderful talking with you, Dr. Fairley. Thank you so much.
Thank you.
Absolutely. We'll share a little more information so folks can learn more. You can head online, visit vcuhealth.org. Virginia This Morning returns right after this break.